I'm Andy Park. Today, I'm going to introduce Korea's medical system and medical level, and I'm also going to tell you that many Koreans are doing medical service in Africa and poor countries. Korea's medical system and medical technology are considered the best in the world, and its medical infrastructure is considered the world's strongest. It's an old story. It was 26 years ago in 1996 that Korea emerged as an innovative technology for gastric cancer surgery, which surprised the world and surprised Japanese doctors, who were the origin of gastric cancer surgery at the time. Since then, Korea's medical level has already entered the advanced medical world, with the best results recorded in the medical community. Since then, the number of Korean doctors studying in Japan has decreased significantly, and instead, it became a turning point for Japanese doctors to start visiting Korea. Samsung Medical Center, Yonsei University Hospital, Bundang-cha Hospital, and Seoul National University Hospital in Korea are considered the world's best survival rate, success rate, and patient satisfaction in many fields such as stomach cancer and colon cancer. Recently, many doctors from China, Singapore, Thailand, Tajikistan, India, Uganda, Nepal, and Mongolia have visited Korean hospitals for advanced medical training and are conducting training programs at hospitals. Imagine you're a resident of Korea and you fall ill. You go to see a doctor at a nearby hospital and present your Korean health insurance card. The doctor examines you and prescribes some medication and a series of tests. You pay the initial fee at the hospital, which is usually a small percentage of the total cost of treatment. The hospital then bills your insurance provider directly for the rest of the costs. In Korea, the National Health Insurance Scheme covers a large portion of medical expenses, including hospitalization, surgery, and most diagnostic tests. If the prescribed medication is not covered by the National Insurance Scheme, you'll have to pay for it yourself. However, even in this case, you'll still receive a discount, as the government regulates the prices of drugs. If you require further medical attention, such as a specialist consultation or a surgical procedure, your doctor will refer you to the appropriate specialist or hospital. The cost of these services will also be covered by your insurance, with the exception of certain high-cost treatments or procedures. In Korea, there are some co-payments required for certain medical services, such as dental care or traditional Korean medicine, but these fees are also heavily subsidized by the government. Korea is a country where anyone who is sick can go to the hospital without any financial burden. Hospital expenses are relatively low because medical insurance is applied to the entire nation. Did you know that Korea is the only country that provides medical insurance to the entire nation? In particular, cancer patients can receive treatment with a very low levy of around 5%. If you get 10 million won worth of treatment, you only have to pay 500,000 won. If you are prescribed for simple trauma treatment or a cold at a hospital, the hospital fee is about 20,000 won in Korea, and the personal burden is around 4,000 won to 5,000 won. What about America? It will probably cost 1.3 million won to 1.5 million won. It's crazy. 45,000 won is enough, but paying 1.5 million won is beyond my imagination. In the case of childbirth, it costs about 300,000 won to 400,000 won when giving birth naturally in Korea. It's about 800,000 won for a caesarean section. In the US, when nothing happens, it costs about 12 million won for natural delivery. It costs about 29 million won for a caesarean section, and about 38 million won for various tests, so the cost is enormous. You may wonder if the quality of medical care will decrease if it is this cheap, but it is not. Recently, doctors from many hospitals around the world come to Korea to receive training, so Korea is the only country where anyone can go to the hospital without waiting time and receive treatment immediately. Some countries, such as Europe and the United Kingdom, have free hospital bills. Of course, it's all taxed, but as it's free, the quality of medical care is very low, or you often have to wait a few days and months to go to a hospital, and there are so many gates you have to go through to see a professional doctor. In such a country like the United States, it is difficult to have medical insurance like this, and even if you have medical insurance, you have to sell a house with just one surgery. So the patient can't go to the hospital. There's Obamacare that we know well, and it's not just for all Americans, and even this system is almost being abolished. Unlike Korea, the United States does not have national health insurance, and all of them are subscribed to and benefited from private health insurance, which is very inconvenient and very complicated. Once you are not connected to the insurance company and the hospital, you will not be eligible for insurance, and will have to pay a considerable amount of hospital and medicine. On the contrary, in Korea, because the NHS covers all hospitals, specialists can be treated at a low cost through the national health insurance, and in the United States, 60% of Americans' bankruptcy is due to hospital bills, and 45,000 people die a year without hospital bills. Korea's medical system is the best system for patients in the world. Many countries have actually made research and tried to imitate our medical system, but it has not been achieved. Let me tell you a few good things about the Korean medical system. First, Korea is the only country that provides medical insurance to the entire nation. In particular, for cancer patients, the out-of-pocket charge is 5%, which means I got $1 million treatment. I got an anti-cancer injection worth $1 million won. Then you just have to pay 50,000 won and 100,000 won. There is no better country than this. Second, I'm not saying that if it's this cheap, medical standards, technology, equipment, and hospital facilities are at the top of the world. So many doctors from all over the world come to Korea for training. So medical facilities and technology need not be questioned. The third one goes really fast. For example, if you go to a nearby hospital, you can make a reservation and do it this afternoon. Koreans living in Canada, Europe, or New Zealand are coming for treatment, but the reason why they come is because they are too slow. For example, if you're sick, you see a family doctor who's your local doctor. After meeting, you have to solve most things there, and if you really need to see a professional doctor, you have to wait a few months to see a specialist. That's why they are so frustrated. The hospital treatment price is low, so even if it hurts a little, I go to the hospital so there were too many patients. Whether it is a private hospital or a university hospital, there are so many patients that it's natural to say that you'll wait 30 minutes for 3 minutes for treatment. The other is that the state now covers a significant portion of healthcare costs, so the state controls healthcare price. It can be seen as a disadvantage from the doctor's point of view. Overall, Korea's medical insurance system is designed to ensure that all residents have access to quality healthcare, regardless of their income or social status. It's a comprehensive and affordable system that has become a model for many other countries around the world. Many Koreans are working abroad in Africa, or poor countries, for medical service. The world generally views the work of Korean medical professionals in Africa and other poor countries in a positive light. These efforts are often seen as a form of humanitarian aid, aimed at providing much-needed medical services to communities that may lack access to adequate healthcare. These missions demonstrate Korea's commitment to helping improve the health and well-being of people in need around the world. The work of Korean medical professionals in these countries is often recognized and praised by international organizations, such as the World Health Organization and the United Nations. These organizations have repeatedly stressed the importance of improving healthcare services in low-income countries, and the efforts of Korean medical professionals are seen as a step in the right direction. Korean medical professionals working in Africa and other poor countries often face significant challenges, including language barriers, cultural differences, and limited resources. Despite these obstacles, they continue to provide vital medical services to those in need, often under difficult conditions. In recent years, the global community has become increasingly aware of the need to address healthcare disparities and to provide medical services to underserved communities. The work of Korean medical professionals in Africa and other poor countries is an important contribution to this effort and is likely to continue to be recognized and valued by the international community. Finally, you must register insurance in the following cases. Foreigners and foreign nationals are required to subscribe to health insurance. Foreigners and overseas Koreans who have stayed for more than 6 months will mandatorily be registered as local health insurance subscribers from July 16, 2019, and will receive the same insurance benefits as Koreans. For more information, please go to the website below and ask for related information. https www.nhis or .kr. Thanks for watching.